Hi, I'm Harjit. I'm F3. I'm thinking about doing my MSRA this year for GP. When it comes to the professional dilemma section, I'm kind of a bit more concerned about certain aspects. So when I'm doing the questions, I struggle trying to figure out which of the options come first when I'm doing the questions. Obviously, each of the options are meant to be quite similar, but to me they seem quite equally as important. So I struggle to differentiate between them. So is there anything that you could suggest when I'm dealing with it?
Absolutely, Harjit. I think firstly, welcome to the good side, man. You're going to come into GP. That's the music to my ears. Obviously, the best profession. Not like this. I'm a doctor of just an elbow. You're going to be the doctor of everything, which is good to know. Now, I think with anything, especially with answering questions, you need a good strategy of how you're going to answer things. And when you look at the MSRA and you look at the answers broadly, there's two ways of looking at it, right? The first thing is there's some obvious right answers and there's some obvious wrong answers. But then, as you alluded to, there are some things where it makes it a lot more difficult in terms of separating what is the ranking number 1 versus ranking number 2, and ranking number 4 versus ranking number 5. Or even 2 to 3 and 3 to 4, etc. So those kind of small areas of separation can be quite difficult. And I think you just have to apply some basic concepts. So I'm hoping that you've read the Good Medical Guidance, chapter to chapter, verse on verse, and it's like your Bible. But if it's not, that's fine. Chuck into ChatGPT and get a summary. If you think about the questions, there's always going to be, in terms of answers, certain answers which kind of overlap with the other ones. And so you need to use certain principles to help guide you through this, okay? So I'm hoping that you've used the GMC Good Medical Guidance and you've dived into that and looked into that in a lot of depth, because actually that's going to give, if there's one thing you can do preparing for this exam, literally one thing you can do preparing for the exam, I would say read the Good Medical Guidance cover to cover, chuck it into ChatGPT, into Copilot, into whatever you want to do, and just produce a summary sheet for yourself, like conceptually, because it will guide you. And this is literally the only thing I did. So a lot of people did like loads of question banks and did lots of other things, but I just literally read that before my MSRA and I got a place straight away. Key to all of this, right? There's some basic principles of medicine, and I know it's kind of like going through the basics a lot. But I would say that if you're not thinking about patient safety as your number one priority, then you are absolutely failing. So the principle of first do no harm is so important. And in the questions that you have, patient safety can manifest itself, I think, in a couple of ways. So there's the obvious thing, right? Like, so for example, someone's got a potassium of 6.7. So it's obvious, like, okay, let's do an ECG or let's ask them some symptoms. And that's like, how when you think of an answer, it's like the first level answer. But the separation between like things which are super close is you need to look for the secondary answer. Do you see what I'm saying? So it's not just about saying what's the obvious thing that they're looking for in terms of safety. It's about looking for the next thing that's there in terms of safety as well, not just the most obvious thing as well. So actively looking for that second tier concept or idea or aspect of safety is really, really important. It's kind of like, I don't know if you guys remember doing like the 11 plus, right? And you do like abstract reasoning. And then when you do the abstract reasoning, there's only a finite number of patterns that can come up, right? So you're like, oh, the circle's going from the bottom half to the top half. And like, you have to learn those patterns repetitively. And it's the same thing with the MSRA. There's only a finite number of things they can ask with regards to, like, say, patient safety, right? So when you're looking for that, I would say look for the first differential of obvious answers, then look for the second one as well. And often most people aren't looking for that second one because they're kind of pressured, things that, it's a stressful examination obviously as well. So I think patient safety is obviously really, really important. And then the flip side to that, as I mentioned, was obviously imminent harm as well. I think a big test in the MSRA, which they want you to understand, which as a GP now, and I hold different roles within the NHS, is they want people who can also understand how to be how to do the right thing at the right time, so be proportionate in their response. So, for example, when you have the colleague who is doing something silly, right? It's not like reporting to the GMC straight away, right? It's a kind of proportionate escalation of things as well. So also proportionate to where you are and what you can do as well. So I think a lot of people, what they think about everything in a very binary fashion. But again, you need to be thinking about things in much more spectrally, like saying, okay, well, obviously this person has done X, but how do I escalate that safely along the food chain to the right answer as well? So I suppose in conclusion, what I'm trying to say is read the GMC Good Medical Guidance cover to cover. There's some basic principles that you need to know. So if anything that you're going to take away from this answer is patient safety is number one. But with patient safety and in terms of question and answering the questions, think about those second level to those questions as well, and really look for those. That's really, really important.
No, I think so. I think it's a case of we need to figure out what the secondary part of the answer is, basically, and use that to lower certain questions.
Okay, absolutely.
Kind of going on from something that you said in there, you said about like the escalation pathway as well. Obviously, I've done my F1 and F2, and in practice, it's a bit different with like registrars not being on the ward or doctors not being available to talk to consultants, etc. I keep sort of second guessing myself when it comes to exam in an exam setting. When should I escalate versus when should I try and handle things for myself? Obviously, how do I sort of get that right in an exam?
So this is going to sound a bit crazy and a bit wishy-washy, but I think one thing I would really like you guys to do is, you guys have all been doctors for 2 years minimum now, right? All of you. Right. So when you've all been faced with these scenarios before, actually the MSRA is actually testing scenarios that you've all been in. Whether you've acted in the scenarios or not is a different question, but you've all would have been faced with that thought process at some point in your career, right? We've all held a bleep and we've all been asked to go and do something, beyond our competency, or we've been asked to, there's been a complaint and we've all been asked to escalate, but we've all been in these scenarios in different ways. So one of the things that that's drilled into us, and I know we're belaboring it a lot, but it's really the idea of knowing what your competencies are. So like, for example, me, right, as a GP, any of you guys who have done GP jobs know that we work quite rigidly in terms of how we prescribe, right? So for example, there's a patient who comes in and says, look, I need melatonin for my ADHD, or I need methylphenidate for my ADHD. We'll need that shared care agreement, right? So it's about knowing what your specific competencies are, and also what kind of framework you can work within. If you cannot work within that framework, like, you have to ask yourself the question, who can I escalate or who can I delegate to who can help answer that question? It's a bit like a diagnosis, really. If you don't know the answer, who or what can you utilize, or what test can you utilize to get you to that answer? That's really, really important. And what they're trying to teach you here is basically a very important concept which a lot of people don't understand, which is self-awareness, right? So self-awareness of knowing your own limitations in terms of different practices as well. So when it comes down to escalating, the first question is, can I handle this safely and competently? Is it within my remit, my professional remit, my scope of work, as they say in revalidation, or is it not? And if it's not, who can I ask to then help me do the appropriate thing? So for example, if it's going to be a pediatric case and there's going to be a safeguarding in place and you're in PAU, is the right option to be speaking to the SHO or the registrar? Or is it just be like, I need to pick up the phone to the consultant right now and ask them their opinion? You need to pick up the phone to the consultant right there and then and ask them for their opinion, because that's the most sensible thing to do at that moment in time. So it's kind of understanding what type of work can be solved by who as well. So that's that tree of escalation. But to answer your question, is go back to those clinical scenarios that you literally face day to day in work and try and draw on those experiences as well. So I was coaching somebody on the MSRA and the professional dilemmas, and one of the things, the exercises that I made him do, and this is going to sound very GP of me, and Harjit, I know you're going to laugh, but like literally is to reflect on some of those clinical experiences. Like literally reflect and say, okay, I went through X. How can I relate it to one of the key concepts that we've been discussing here, whether it's patient safety, whether it's escalation, whether it's honesty, whether it's probity, and actually think about how I can improve based upon that as well. Now that's obviously, with a time frame of a couple of months coming up, that can be a bit infeasible, but I would suggest, if you have time, like building that into your actual way of studying for the exam is really, really important. It would honestly make you 100% more prepared for the exam. I guarantee it.